Okay, good evening and welcome to the Board of Health meeting, Monday, November 1st, 2021. And before we jump in, I'd just like to welcome our new health agent, Jean Marie. Welcome.
Thank you.
So we have no hearings or appointments scheduled tonight. So our first action item is to approve minutes from October 19th.
So we're going to pass on the 13th for now and just do the 19th.
Got it.
I'm not sure why I email these to you guys.
I read them.
I read them. Well, at power, so I couldn't,
Right,
service, I
understand.
couldn't read anything.
Okay, so I'll entertain a motion to accept the minutes for October 19th.
Motion.
Okay, motion Matt. Do we have a second?
Second.
Second Lisa. Any discussions? Hearing none, all in favor?
Aye.
Aye, so that passed. Okay. So, next on the agenda is to approve disposal work permits for what's, I'm gonna read what's on the agenda, and then we'll discuss a couple of them. 47 Folsom revision. 20 Arrow Path was a last-minute add. And we have lots 1, 2, and 15 on Daisy Lane. And lots 1, 2, and 15 on Daisy Lane, we're gonna remove from the agenda. There's some additional information that we're looking to receive from the engineers. And then we can clean those up and put those back at a later date. So, I'll entertain a motion to approve the disposal work permits for 47 Folsom revision and 20 Arrow Path.
Motion to
Okay,
approve.
so motion Lisa,
Second.
second Matt. Any discussions?
Just for your knowledge, 47 Folsom, the only revision was they had to add conservation markers after going to conservation for the wetlands. So there's no change to the septic system, but
Gotcha.
you want to make sure the septic installer has the latest plan.
Okay. All right, great, thank you. Any other discussions? Hearing none, all in favor?
Aye.
Aye, passes. Jean Marie, do you just want to speak briefly to lots 1, 2, and 15?
Okay, yeah, these are new construction, and although Bob's looked at them, he said prove them with the following provisions. I'm more of the type that this plan is going out to an installer, it should have what we need on it. It was missing the benchmarks, and where the benchmarks were.
Okay.
There are no observation holes or perks in the reserve area. Title V requires that. So if you went out and found ledge or bad soils, you would then have to revamp the whole thing and you've got an open hole. So I try to avoid those things. And code does require that you've looked at both those areas. They also didn't indicate that it's a zone 2, nitrogen sensitive
Right.
area, which makes a difference in, if a perk rate's less than 2, you need 5 feet to groundwater, which one of the plans is missing, it says 4. And it's based on acreage, on how many bedrooms you can have. So those are kind of important.
All right, great, thank you.
Just a quick question. You've noted that they don't have street numbers. Is that something you would hold against them if there were lots without buildings yet?
No.
Okay.
But the benchmark, you really need to know if it's a nail in a tree or a nail in a stone,
Yeah,
or,
yeah.
you know, where you're coming from and what you're calling it.
Yeah, got it. Okay, cool. Thank you.
All right, so now we have some bills. We have bills from Buger and Sons and B&D Associates.
You want to do separate?
The bill should have been
Unless
at
you
the
want to do them all
front.
together.
I'm just trying to find, where's the B&D?
It's right.
Should be at the
it's
top.
2 pages of Bucher's and then 1 for B&D. It's the medical list. Right there.
Perfect.
Oh, that's the one I gave you upstairs. Yeah, that's yours.
Okay. So the medical waste pickup, that's the
Syringes.
needle pump, yeah.
Yeah.
Okay. All right, so I'll make a motion that we accept the bills from Bucher and Sons as well as B&D Associates as presented.
Second.
Second, Matt. Any discussion? Hearing none. All in favor?
Aye.
Aye. That passes. Okay, now we have a food service permit for Batter Up Cookie. They're a residential kitchen. Let's see, Earthworks. Here we are.
So is there a limit for how many food service permits we can issue per town? No.
Not like liquor licenses, no?
No, it's not.
Okay, I will accept a motion to approve the food service permit for Batter Up Cookies.
I'll motion.
Okay, motion Matt,
Second.
second Lisa. Any discussion? All in favor? Aye.
Aye.
Passes. Okay, and then we have 2 installer permits from Advanced Earthworks and Ace Excavation.
So Advanced Earthworks was new and they took the Title V test and passed it, and Ace Excavation is a renewal.
Okay. So I'll make a motion to, that we approve the installer's permits for Advanced Earthworks and Ace Excavation as presented. A second? Second, Lisa. Any discussion? Hearing none, all in favor?
Aye.
Aye. Passes. And then we have a septic haulers permit from Miles of Excavation. Sue?
Yep, that's a new hauler, so normally we see these in like January for the year, so somebody new that wants to come in town. I believe he plans on taking his test to be an installer also. It just hasn't worked out that he's been able to get here to take the test yet.
Okay.
But haulers don't require any kind of a test or anything like that. They're just pumping.
Did he list his disposal site?
Yes. Yep. It's Rainham.
Okay, I'll entertain a motion to approve the septic hauler permit for Miles of Excavating.
Motion?
Motion Lisa,
Second.
second Matt. Any discussions? Hearing none, all in favor? Aye.
Aye.
Passes. Okay. So, Sue, can you lead us in the COVID cases and vaccination? And then if, Jean Marie, if you have anything to add, please, you know,
Yep, so
shine.
cases were slightly down in the last period. Heather did pretty much all of this. She's been doing all the tracing. I've kind of put her as the charged person now that I am no longer the acting health agent. So she's kind of the contact person. I did email Maven to get Jean Marie set up. I think the person that does the setup is on vacation though, so I'm just waiting for him to get back. She's already trained in it, so she should just be able to hop right on too.
Great.
No significant jump or anything, and the school didn't really have school last week, so it's been kind of quiet. And then Karen Clifford came over last week, and we tried to do a survey on how many total kids we had vaccinated in the school, and I think at the moment with just kids, it was like 57%. we didn't have a number. 95% of teachers are vaccinated, but we don't have yet, she hasn't given me yet a total number of how many staff there is, and then put the two together and get the percentage, but we're obviously not at 80% yet.
Did she,
How-
I'm sorry, just, go ahead.
How is she factoring how many kids are, is it just the ones that participated in the clinic?
Nope. So I have MIS access. So what she did was she printed every single kid's name that goes to school in East Bridgewater. I printed every single person that's vaccinated in East Bridgewater. I can't let her see who that is, so she read their name, I looked at the list, and I checked who was vaccinated, then tallied them. So, and then that's how we got it. So she got a number without names. So it was we just kind of did a read-aloud standoff. The two of us locked ourselves in the office last Monday night. And then she was still working on getting, because I think the teachers initially had been more of a survey, but now they're doing more of a formal account, getting attestation forms and all that kind of stuff. Osco Drug contacted the school. I guess it's somebody that they've worked with before in flu clinics, and they're gonna come do boosters for all the staff over there. And they are going to offer it up to all of our first responders here that want them. So, I guess, in that way, they'll have the ability to have more than one kind of vaccine because it's a pharmacy and, there's variety. And then here, we got an email Friday from Pfizer indicating that we would be receiving vaccine because we are on the list of people qualified to receive vaccines for the 5 to 12-year-olds. So I let obviously Jean Marie on day one know, hey, by the way, we might be getting vaccine. Let Heather know, let Chris Olson know, who's been kind of the point man from the fire department, because they switched from prep mod to color, which if you went to like Gillette or something to get your shot, they use this color system that's a little bit different that none of us are trained on. So now, Jean Marie, myself, Chris, and Heather will all have to get trained on color. And then once we're up and running, we could hold a clinic presumably at this school, but they're 5 to 12-year-olds, so maybe the middle school, the central school, I don't really know. And then if we don't get the people to sign up, we can call DPH and they can reallocate it to the unopened bottles to another town or a pediatrician, or, they can do it that way. We can't just give it away, but they can come and reallocate it.
And what's the time frame on that, do we know? It's just-
So because of the storm, we could get the vaccine by the end of this week. It's good for 90 days in the fridge.
Okay. And then
So-
administering the doses, is there a
We don't want to,
tentative or?
no, because number one, want to make sure we're up online on this color, because we need that to schedule the appointments and for them to log, we're not going to be doing it manually. And then we want to have it actually in hand before we have a date, so.
Okay.
I know, we're going to work around Heather's schedule, because she's going to be like the lead on the clinic, and got to work around Chris Olson's schedule, because I tagged him to train on color to do it too. If Lisa wants to come give some injections, she's a registered nurse too, so she could hop on. I could get you the access. I know you have kind of a crazy schedule right now.
Yeah, I'm sure I could figure it out. I just think, it's just such a touchy.
Yeah, and I honestly don't know that we'll get,
I see more going to the.
yeah, I don't think we'll get the.
Well, my thing is, if a parent presents their child and the child is resistant and doesn't want the shot,
Yeah.
do we force the child, or do they have to comply
I
themselves?
don't
It's
think,
like-
that would be tough. I don't think that
Yeah,
Heather or anybody from the fire department would do that, so I
It's,
don't know. I don't know.
I agree,
Yeah,
it's a touchy
because
situation.
Yeah.
most 5 to 7-year-old, they're
Right.
not gonna wanna get a
Right,
needle.
right, so that's,
Especially
yeah.
that size needle.
Yeah,
Yeah.
so that's a good question. And, I don't know the answer to that, because
Yeah.
I wouldn't be the one administering it.
Mm-hmm.
If a child has that much resistance, I really think the public clinic's maybe not the space for them.
That age group is very resistant.
Do you know what I mean?
Yeah, that was what
Yeah.
my holdup was when they announced it. It was like, I've had my own children, my daughter who's 18, I still physically restrained to get a shot.
So my granddaughter
And I have to
Erica
talk
needs
to
herself,
them
yeah.
too, yeah.
Yeah, that's a good question.
So it's like,
That's
it's
a
the
tough
one thing if
job.
the parent wants it, it's the whole other thing if the kid's hysterical, and then how long do you wait for them to calm down? Do they go to the back of the line? You know what I mean? It's
Right.
like kind of a,
It's a really
Slippery
hard
slope.
age.
Yeah.
Yeah.
It's a good question, so.
It's not a good position to be putting us in, not.
Putting anybody in, for that matter,
Yeah.
yeah.
Yep, and, if the board's not comfortable doing it and they want me to ask the state to reallocate the whole thing, I mean, I know the school, the superintendent is very interested, and she would really like it. Or at least have it offered, not
Yeah.
necessarily if we don't get that many people to come, then we can reevaluate, but she's very big on having, like, on-site offerings for vaccinations.
Looks good, but it's
Yeah.
difficult.
It's a, yeah.
So have we talked to Karen or Mrs. Clifford or?
Yep, oh, yeah, no,
No,
Karen,
about the resistance factor.
no,
And
that was the first time it's
and
come up,
then,
when Lisa just asked about that,
You know,
so.
Thank you
I
for
mean,
that,
You
yeah.
two obviously have field experience in this, but, Chris from fire department, if he's that, and I don't know if there's, come up with a, a plan that at some point in time.
Yeah.
During the process, after a short period of time, that you just have a quick discussion with the parent that best course from here might be, your pediatrician or something like that.
Yep.
Because again, you don't want to put somebody in an uncomfortable position where, you get a stranglehold on a youngin' and then someone's.
Right. And Heather has a lot of pediatric experience. I think she does pediatric infusion in home
Yeah.
therapy, so she's got a good handle on kids. So maybe she gets all the all the resistant children. I don't know. But that's honestly, that's a question like it never even occurred to me, Lisa. So
Yeah, 'cause
it
once
should have
it's-
occurred to me because I've had to hold my kids down too.
Yeah.
But I would probably be the parent that brought my kid to the pediatrician because they are scared. So I would know they
Right.
wouldn't do well.
I just think that, in most cases, kids don't want injections, and
of course
parents
not.
do want the injections,
Yeah.
and it's a whole different ballgame. And then you run the, if they
Yeah.
have a reaction, are we liable? If, you know what I mean?
Yeah,
If they're
right.
not on board with getting it, it's kind of
Yeah.
touchy.
Yep.
Okay. 11:01, are we past mosquitoes?
No, we haven't had the first hot freeze yet.
Okay, so that's what it takes.
Yeah, not even a frost, right? Isn't it a hard freeze?
Freeze.
Yeah, freeze,
it's a
yeah.
freeze.
No.
Frost they hide under the leaves.
Then the only other thing that I had was the, we obviously lost power last week, so I reached out to Rob Casper on the criteria, how many hours, to stop throwing food away. We sent out a mass email to every food service license holder in East Bridgewater and asked for a reply with what their plan was, and a good portion of them had generators servicing all their refrigerators. We had a few that had to throw away a lot of product, like perfectly flavored, put all their stuff in their food truck and ran the generator all night. And then we had the whole strip of 18 from Carriage Crossing to Viking Pizza that didn't lose power. It seems like everyone did what they needed to do, and probably have to do it again sometime before the year's out.
Thanks for that follow-up as well. I know, juggling no power and
It was fun.
portal,
It was fun, yeah.
lack of internet access and
Yeah.
all the rest of it, so and I appreciate that, thank you.
That's all I got.
Office updates?
That was it, yeah, that was everything,
That's
all kind of rattled into one.
Yep.
Okay. So Jean Marie, we do have a bullet on here, a health agent update, but if,
I sort of gave them to you already.
okay, gotcha, that was it, all right, I know, day one was a meeting day and a long day, so, appreciate you getting everything done. Again, welcome aboard. And I do not have any topics that would be reasonably unanticipated by the chair or the committee. Does anyone have anything else to add?
Nope.
Okay, so at this time, I'll entertain a motion to adjourn.
Motion.
Motion, Matt.
Second.
Second, Lisa. Any discussion? Hearing none. All in favor?
Aye.
Aye. And passes.